Good evening, all. Today, my topic is emergence of mucormycosis in post-COVID infections. Coronavirus disease 2019 COVID-19. It is attributed to severe acute respiratory distress syndrome SARS-CoV-2, and it was declared as global pandemic by the World Health Organization in March 2020. And globally, mucormycosis now it has started as an epidemic in the pandemic of COVID-19, and the incidence ranges from usually 0.005 to 1.7 per million population all over the world. But in India, the reported prevalence was 0.142 to 1000 per million. Approximately, it is 80 times higher than that in developed countries, and making India the country with the highest burden of mucormycosis. And mucormycosis was first described in 1876 when Furbinger described in a patient who died of cancer with right lung hemorrhagic infarct with fungal hyphae and fused pharyngia. And in 1885, Arnold Palter published the first case of disseminated mucormycosis. Now, the concomitant conditions like diabetes mellitus, immunocompromised conditions, and excess use of immunosuppressive agents led to immune dysregulation in COVID-19. And this led to rate of hospital fungal and secondary bacterial infection has been reported to be 80% in COVID-19 infections. And previous reports observed that fungal infections were more likely to develop during the advanced stage of COVID-19 infection. And though the mucormycosis cases were not seen in the first wave of COVID-19, there is a steep and surge of mucormycosis cases in the second wave of COVID-19 pandemic. So this substantial higher mortality rate of 53% among patients with a fungal co-infection is seen. As the current pandemic may rise in near future as third wave, as per WHO, the heightened awareness about mucormycosis is needed among population, and as co-infection causes significant mortality and morbidity. In this study, our objective is we want to establish the relation of diabetes mellitus, steroid usage, oxygen inhalation, and other risk factors in post-COVID patients suspected with mucormycosis in total of 80 patients attending post-COVID OP and their diagnostic methods in laboratory of Department of Microbiology. Analysis of demographic features, predisposing conditions, clinical features, morphology and culture characters, and radiological features of suspected mucormycosis cases. So, in the material and methods, the present study was taken up on total 100 patients, which include 80 suspected post-COVID mucormycosis cases and 20 post-COVID cases as control. And we received two samples. Usually one is from saline nasal ward, and second one is post-debridement tissues from all the suspected cases of mucormycosis admitted in mucor ward. And the direct examination of samples by KOH mount using 10% KOH and observed for fungal elements under microscope. All the positive and negative samples in KOH mount are cultured on Sabrat's bistro agar and incubated at 22 degrees centigrade at BOD and 37 degrees centigrade. All the culture positives are again observed under LPCB mount, lactophenol cotton blue, staining for identification and differentiation of species. Here the picture shows the growth factor of mucor on SDA, plain SDA, and also SDA with actinium. And here we have cultured in the BOD. The first picture is showing the BOD with different Sabrat agars and when they were incubated, and the second picture showing the rhizopus, and the third one is aspergillus, and fourth one is candida, and fifth one is mucor, and sixth one is the aspergillus niger. As CAM means COVID-associated mucormycosis, and Kappa means COVID-associated aspergillus. Here we are able to isolate all the we are able to isolate the Aspergillus species and also the mucor species. There are the different patient pictures, suspected cases of mucormycosis patients who helped for our study. And here in the first picture, the KOH mount showing the aseptate hyphae, and second one is KOH mount showing the septate hyphae, and third picture showing the budding yeast cells in the KOH mount, and fourth picture is showing the Aspergillus sporangium in the KOH mount. And when the cultures are positive, they were subjected to LPCB staining, lactophenol cotton blue staining. And the first picture is showing Aspergillus fumigatus, and second one is Aspergillus niger. And third species is the third picture showing the mucor species, and fourth one is Fusarium, and fifth one is Rhizopus. So coming to the results, during the study period, a total of suspected 80 post-COVID mucormycosis cases and 20 post-COVID controls are studied. And importantly, at the point of hospitalization, the majority of subjects are not vaccinated for COVID-19. This is an observation taken, and only 3 among those suspected cases out of 80, only 3 people were vaccinated, and that too they have only received 1 single dose of vaccine. And in the control study, 20 post-COVID cases, saline wash and the nasal scraping samples without any history of diabetes, usage of corticosteroids, or any mechanical or oxygen inhalation, mechanical support, ventilation, and without any symptoms of mucormycosis are collected and studied and observed on KOH mount. All samples are found to be negative for fungal elements, and there was no growth seen on FDA. Thus, no evidence of mucormycosis noted in the 20 patients of the post-COVID cases. And here the pie chart is showing the sex distribution, whereas the 59 cases among 80 people were males and 21 among 80 were females. 64% is the male predominance of mucormycosis, and 26% are the female distribution. And the second table, based on the clinical features, usually among 80 people, 80 suspected mucormycosis patients, 69 have reported the clinical symptoms of headache, 59 cheek swelling and pain, and 36 were eye swelling or pain. Headache is the most common presentation seen in all suspected cases. And table based on the comorbidities and risk factors, the predominance is shown as diabetes mellitus. Out of 80, 46 are positive for diabetes mellitus, having the clinical history of long-standing diabetes, and 30 were corticosteroid usage, gave the history of corticosteroid usage, and 13 on supplementary O2, and all diabetes mellitus, corticosteroid usage, and supplementary oxygen inhalations were seen in 9 patients. Table based on culture, out of 80, 26 were culture positives. Among them, mucor 10 cases were positive, Rhizopus 6 positive, and Aspergillus species 5. And COVID-19 associated with mucor is called CAM, and they were predominant. And the copper is COVID-19 associated pulmonary aspergillosis. Usually that is also most common after mucormycosis. And Fusarium species, 1 Fusarium is isolated and Candida 1, and Aspergillus plus mucor co-infection is seen in 3 people out of 26. In the discussion, we report the demographic, clinical, and diagnostic features of COVID-19 patients and poor glycemic control. That is the most predominant condition, and moderately severe pneumonia, steroid usage, mechanical ventilation, and non-receipt of COVID-19 vaccine were the commonest predisposing factors for mucormycosis. The disease portends a rapid clinical course with the worldwide mortality reaching 46%, and in India it is 53%. And the organisms commonly implicated in the disorder originate from the mucorales order and include mucor, Rhizopus, Rhizomucor, Actidia, Apophytomyces, Succinesia, and Cunningham. And the fungus usually resides as a commensal in the nasal mucosa, and fungal spores gain entry via inhalation and subsequently enter the paranasal sinuses. Affected individuals usually present with acute sinusitis, fever, nasal congestion, and purulent nasal discharge and headache. Usually, the orbital cavity is accessible through the ethmoid bone via lamina peperosia, infratemporal fossa, and inferior orbital fissure of the orbital apex. And contiguous intracranial extension is through cribriform plate, ethmoid, cribriform plate, and supraorbital fissure and perineural roots are common. And cavernous sinus are sagittal sinus thrombosis and carotid occlusion, cerebral infarction, intracranial aneurysm, intracranial hemorrhage. Cerebral abscess are potential sequelae for cerebral mucormycosis. Depending on the affected organ, the infection can be classified as sinoorbital, rhinocerebral, pulmonary, cutaneous, gastrointestinal, and disseminated. The most common type of mucormycosis is ROCM, rhinocerebral orbital mucormycosis, which is about 44 to 49%, followed by cutaneous, pulmonary, disseminated, and gastrointestinal. And diabetes, especially when uncontrolled, represents the single most common predisposing factor for mucormycosis in India, being reported in more than 50% of cases of mucormycosis. SARS-CoV-2 virus has been found to impair cell-mediated immunity due to decrease in CD4 plus CD8 cell count, increasing the vulnerability to fungal infections. This is under many multiple element predisposing factors. This is one of the immunological dysregulation that is more common in the COVID-19 patients, along with the diabetes mellitus. And concomitant medical problems including diabetes, acute respiratory distress syndrome, ARDS, and the use of corticosteroids and broad-spectrum antibiotics are additional predisposing factors. The mortality rate has been found to be significantly higher in patients with COVID-19 and secondary fungal infections, and it is raised up to 53% as compared to the only COVID infections is of 31%. And despite early diagnosis and aggressive surgical and medical therapy, the prognosis for recovery from mucormycosis is generally poor. And the pathophysiology is usually diabetes may cause alterations in the cell-mediated immunity, and cytokine storm include reduced natural killer cell activity and attenuated gamma interferon response. And the endothelial dysfunction and vasoconstriction may result in tissue ischemia and procoagulant state, which is more so common with the Delta variant of the COVID-19 second wave strain. And this caused more emergence of sudden emergence and epidemic of the mucormycosis cases in this pandemic stage. And the presence of broad and non-passy septate fungal hyphae causes necrotizing granulomatous inflammation and angioinvasion. Conclusion: the mortality and morbidity due to mucormycosis played a major role in this pandemic of COVID-19. And so, because of the increased mortality and morbidity due to mucormycosis, we have to alert the public and the population for how to control the post-COVID state. The post-COVID state is very, very important, and the COVID-19 strain itself will cause the hyperglycemic state even in the normal individuals. So, strict maintenance of glycemic index, strategies to maintain glycemic index and ferritin levels which used to be increased in the cytokine storm, that also should be controlled, which facilitate the growth of fungal spores. So all these strategies to maintain glycemic index and ferritin levels has to be implemented to avoid poorer outcomes. And judicious use of corticosteroids and broad spectrum antibiotics should be implemented, and they should be monitored. Strict aseptic precautions should be implemented while using the humidified oxygen and industrial oxygen. Mainly in the second wave, because of the emergency situation, what happened, the industrial oxygen was used for the medical purposes, which usually sometimes the humidification for high flow nasal cannulas also will facilitate the growth of the fungal spores, and this should also be maintained in a strict aseptic precautions. An accelerated vaccination drive and awareness in population may help us to prevent massive outbreaks, complications, and mortality in subsequent waves as predicted by WHO. These are the references where we have taken, and in the United AP state, when it is in the United States, we used to get only one single case of mucormycosis when I am working as assistant in MGM in Sakti Medical College. And after a long time, there is emergence of mucormycosis or flooding of mucormycosis cases in this second wave of COVID pandemic after a long time. So which is a very, very rare condition, and we used to see very rare number of cases in the past 15 years. But suddenly we have, there is registration of 80 and more number of cases are also coming now and registering. And this is a very rare condition of this mucormycosis in this pandemic situation. And these are our references and bibliography for this study. I thank my father, Dr. S. Rajkumar, Superintendent MGM Hospital, Mucormycosis Disease MGM Hospital, and faculty and technical staff of Department of Microbiology, and to all the patients who are included in this study.